To unpack this further for us, we're now joined by Siza Magangoe, who is the Chief Director at Families and Social Crime Prevention in the Department of Social Development, to unpack this further for us. Siza, thank you so much for joining us here on the late edition. Of course, we saw that yesterday the Social Development Department took a visit to the residents of Thaba Nchu. Just tell us more about this initiative, which of course tries to curb the problems around substance abuse and of course the issues facing gender-based violence in that community.
Okay. Thank you very much for having me. Yes, the Department of Social Development, we have partnered with Hosi of Barolong, Basilica, a tribal authority as well. We had a 3-day program. We've launched it since Thursday. The community they are the ones that started raising this, the social ills that they're facing, and they don't know how to go about, where to start, limited resources, they have no capacity in terms of training and so on. So when they reach out to us, we then thought that it was appropriate for us to partner with them and begin, to capacitate them so that they are able to address those challenges. So we had a 3-day program. We started in day 1. It was a day of prayer where the Khosi has invited different ministers and pastors from different denominations to actually begin by prayers.
Yeah.
And
perhaps maybe you can just also give us a bit of an insight there, Siza, when it comes to the problems facing that community, in particular to gender-based violence and to, of course, substance abuse. How bad is that in the community of Thaba Nchu?
It's bad because there's high prevalence, of course, of gender-based violence as well as substance abuse, things like nyaupe, as well as abuse of alcohol. Literally, when we're engaging with the community, things that the research has already indicated to us indeed were confirmed. For instance, HSRC as well as Medical Research Council, they've conducted a research that has indicated to us that we have seen a lot of young people. There's a problem of underage drinking. There's a problem of more women are drinking alcohol, and there's a lot of the availability of substance abuse. It's high in most of the poor communities. So all those things that the literature has been saying to us, they were indeed confirmed. So what we did, it was not just for us, to be overwhelmed by the problems communities were confirming to us, but what was important for us was to begin to come up with an integrated plan that seeks to address those challenges. So we have worked with 42 headmen who are leading 42 villages. They have identified 4 youth, young people in those communities who are able to read and write, who are going to be trained and be able to roll out the Kimoja I'm Fine Without Drugs program, as well as gender-based violence programs that we are doing as a department.
And perhaps maybe if you can just also then unpack and just let us know that these programs in which you're partnering with the community, what exactly will they be looking at and trying to tackle these problems faced by the Thaba Nchu community?
Yeah. Okay. There is a curriculum that we've developed for substance abuse as well as GBV. Let me quickly start with the substance abuse curriculum. We are looking at signs and symptoms of alcohol and drug abuse because most of the parents, they are sitting with young people that are experimenting before them, and they don't know. These signs are there, but they don't know. And if you know, you can easily step in and, curb the problem before it progresses further and becomes more addictive, and it becomes difficult for you to remedy it. So we are focusing on parenting program, dealing with those signs and symptoms. We are also looking at the types of drugs that community is using. For instance, we know that they are high on nyaupe as well as alcohol, cheap alcohol. So we are focusing on that. We are also looking at the referral pathways to say, now that you have identified those ambassadors that are going to be deployed in 42 communities, they will be interacting interacting with communities. They're going to be the eyes and the ears of the chief as well as us as a department. The question is, when they are confronted with those problems, how do they refer them? Do they know where to refer? How to assess and refer? So those are some of the things that they'll be doing. We'll be imparting assessment skills so that they're able to refer them to treatment centers as well as social workers.
And maybe also then you can just let us know then, Siza, how have the parents in the community reacted to this this initiative? I'm sure it's something that will be quite helpful in tackling the problems around substance abuse, which often then leads to gender-based violence.
Yes, the parents and the community at large, they have received us. They receive us well. They are happy and they rally around to say they will support us in whatever way. For instance, when we are doing parenting program, we would need them to avail themselves and attend and not see this as just a by the way thing, but as a core thing that they need to be empowered on. So they are quite supportive. They are ready to work with us, as well as and many other organizations that are willing to put resources to ensure that they help us. Because we said, much as the problem is these two pandemics, which is GBV and substance abuse, but we are not only going to limit our scope and deal with it only. We are also going to deal with issues of economic development, because it's quite critical to make sure that at the end of the day, we provide services holistically.
And how significant is this initiative, especially during a time where we are closing off a Women's Month? I know that you have also mentioned what the president keeps on saying, that gender-based violence itself is a pandemic in this country. I mean, we've seen the levels of femicide in this country. And like you're saying, that there tends to be a correlation when it comes to substance and drug abuse, which then leads to gender-based violence. So how significant is this initiative during Women's Month?
It is to us as a department because we have never worked with tribal authorities. We have always worked with, the normal stakeholders, NGOs, private sector, but we have never worked with this. This is it's a sector that we have left behind, so to speak. And they are the ones that are the custodian of culture. There are some harmful cultural, activities that we will be working with them to say things like Ubutwala is things that we need to address and make sure that we eradicate them in our communities. Things like, all those things that are actually, working against women emancipation. We will be addressing them together with the tribal authorities.
Right,
so we are quite excited. Thing. We are emphasizing on the economic development, because one of the things that makes women to stay in those toxic relationships is because of they are dependent economically. They are, when they think of leaving their relationship, how am I going to survive tomorrow? So by bringing the economic aspect of it, it helps, because it breaks that cycle of poverty, and women are able to be independent and make decisions, not influenced by financial status.
All right then, Siza Magangoe, thank you so much for your time here on The Late Edition. That is Siza Magangoe, who is the Chief Director at Families and Social Crime Prevention in the Department of Social Development.